factors impact your weight. Well, there are quite a number of them. Top and foremost, what you eat. The protein content in your diet is an important factor in weight management. A lot of people don't realize this. Protein actually helps you feel fuller longer. It helps maintain muscle mass, and it actually takes more energy to digest protein than it does to digest carbs. How active you are also impacts your weight. The more active you are throughout the day and the more steps that you can do, it actually increases your non-exercise activity thermogenesis. Now, this is the energy that you spend for everything that you do that is not sleeping, eating, or sports-like exercise. So for example, if you're doing your laundry, you will actually expend more energy doing that if you incorporate more steps into your daily activities. And your stress level, emotional well-being actually affects your weight. A lot of people tend to stress eat or emotional eat. And then there's certain illnesses, common injuries, or other medical conditions that can affect your weight. Some injuries or medical conditions may hinder your ability to exercise, thus causing you to gain weight. And some medications may actually cause you to gain weight. It's one of the side effects. Next slide, please. Okay. So weight gain is actually due to an imbalance of energy in and energy out. And a lot of you may think that all you have to do is eat less and exercise more, or eat less, exercise more, and take a medication. So raise the hands. How many people have done the eat less, exercise more in hopes of losing weight? All right, quite a number of us. Next slide, please. Well, it's actually not that simple, right? Because if it was, lots of us wouldn't be here. So it doesn't always yield the response that we want. Next slide, please. Okay, and that's because obesity is a complex, chronic, and treatable disease, but it's not that easy to treat. According to the World Health Organization data from 2022, 1 in 8 people had obesity, which contributed to 2.5 billion people globally. And currently in the United States alone, we have 650 million adults with obesity. So you're not alone. A lot of people are in the same boat. Obesity is a disease, just like heart disease or diabetes. And we need to recognize that, like heart disease, we have medications, surgeries, and lifestyle modifications to help improve and treat the condition. As you can see from this slide, genetics play a part in obesity. I'm sure that a lot of you felt that you struggled with your weight ever since you were young. Genes can influence things like how a person's body stores fat, metabolizes nutrition, and signals feeling of fullness. We may not be able to change our genetics, but we have the power to change other factors in our lives to help with weight loss. So what I want to focus on is the lifestyle factors that influences your brain, your gut microbiome, and your hormones. The brain is what researchers and studies have termed the hungry brain. I don't know if many of you have heard that, but the hungry brain is what tells you to eat unhealthy foods or that you have a harder time feeling full. That's you tend to overeat. Or for some of you, food acts as an emotional comfort. Then there's the gut microbiome, which is all the tiny bacteria in our gut, intestines, and all over our body. The gut is actually turning out to be our second brain. If you eat a piece of fruit, depending on what your gut microbiome is, you may have a different caloric consumption. This is because everyone has a different gut microbiome. So how much calories it takes to break down that piece of fruit may be different for someone who eats the same piece of fruit. And then there's the hormones. All right, we've all heard of GLP-1s, right? Ozempic, Wegovy, Victoza. The GLP-1 stands for glucagon-like peptide 1, which is a hormone that occurs naturally in the body. And it helps regulate blood sugar, digestion, and appetite. The medications affect the hormones, but there are other things that you can do that also influence these hormones. And that all of these things combined affect a set point weight. The set point weight is actually the weight your body has gotten used to, and your body tries to maintain this weight in the preferred range. So as you increase your weight, your body will adjust the set point weight and it will go higher and higher. So it's actually established over a long period of time. It's actually a very complex thing. And in order to change that, it's not as easy as let's eat less, let's exercise more, or let's take a medication. You have to work on the lifestyle factors in order to change the set point weight. Next slide, please. Okay. So another confusing factor, everyone is a different responder. Some may not lose weight on Ozempic, which is the IT medication right now, and some may lose a lot of weight on metformin, which is a common diabetic medication. So there's not one medication that works for everyone. We all have different factors, different lives that can impact our weight loss journey. Next slide, please. Okay. You need to understand that your lifestyle and your different drivers affect your weight. These different drivers can determine which medications will work best for you. Some medications work at the brain level, some work at the hormone level. So the question is, how do you optimize your lifestyle so that the medication works and you get the best weight loss response? And know that one size does not fit all. In the next couple of slides, I'm going to be talking about the different drivers that may affect your weight loss or weight gain. Next slide, please. Okay, like I mentioned before, there's this thing called the hungry brain. People with hungry brain will feel less full after eating. They will crave ultra-processed foods that are high in calories, but has very little nutritional value. And they tend to think about food even when they're not hungry. So some tips to help manage this. Don't skip meals. Skipping meals actually turn on the hungry brain. Eat a high fiber and protein-rich diet, which will turn off the hungry brain and keep you more satisfied. Sleep is very important. When people don't get enough sleep, it actually turns on the hungry brain. Having good restorative sleep actually quiets down the hungry brain. So make sure you get at least 7 to 9 hours of sleep a night. And then certain weight loss medications such as topamax, phentermine will help manage the hungry brain. So this is how the things that you do combined with certain medications will help turn off the hungry brain and help you lose the weight. Next slide, please. Then there's the emotional brain. So the other driver is people who tend to eat in response to their emotions. And we all do that, right? The holidays are coming up. So what do we do during the holidays? We get together and we eat. Even when we're not hungry, we tend to eat. You know, a lot of our celebrations are around foods, right? The holidays, weddings, anniversary, graduation. We all get together and we eat. And for some people, this is a much stronger driver. They eat when they're stressed, sad, upset, anxious, or even happy. So some tips to help manage this. Change your relationship to food. So the next time you're upset about something, instead of going to the refrigerator and grabbing something to eat, give yourself 30 minutes. Go for a walk or listen to music. And then when that 30 minutes is up, ask yourself, do you want something to eat because you're actually hungry, or is it because you're upset? If you have depression, anxiety, treat those conditions. Don't skip meals. Make sure you get 7 to 9 hours sleep at night. And then there are medications that can help with the emotional brain. Next slide, please. Okay, slow burners. Everyone is born with a different metabolic rate. Everyone's metabolism will slow down with age. It tends to plateau between age 20 to 60 and then decrease by 1% per year after that. And after age 30 to 35, we start to lose muscle mass if we don't work on building it up. The less muscle we have, the slower the metabolism goes. So when you start your weight loss journey, don't just focus on cardio, and more cardio, but also add in weight training to maintain your muscle mass. So some tips to help increase your metabolism. Move more during the day. Increase your steps to increase your non-exercise activity thermogenesis. Build muscle to change hormones like insulin and leptin. Leptin is actually a hormone that helps regulate body weight and appetite. Make sure that you eat a diet that's rich in good quality protein. Make sure you get 7 to 9 hours of sleep nightly. And then we have medications that can help increase your metabolism. Next slide, please. Okay. So the gut microbiome is actually the bacteria that lives in our intestinal system. It's the healthy bacteria that is necessary, and what we eat influences this. Studies have shown that the gut microbiome is associated with overall health and is linked to a lot of conditions like high blood pressure, diabetes, irritable bowel syndrome, anxiety, depression, and obviously obesity. What we eat can maintain and grow a healthy gut microbiome. So all the plant foods that we eat helps maintain it, and the healthy helps maintain it, and it helps the healthy bacteria grow. So some tips for this: avoid ultra processed foods, because ultra processed foods has nothing to help maintain a healthy gut. Eat a high fiber whole foods diet. Basically, eat foods that include various colors of the rainbow. Eat carrots, that's orange, eggplant, that's purple, beets that are red, various fruits, vegetables. Make sure you get a wide variety of colors. And then consider eating fermented foods such as sauerkraut, kimchi, pickles, and Greek yogurt. The fermented foods actually help put healthy gut bacteria in your gut, and the high fiber foods help to feed healthy gut bacteria and helps it grow. All right, I'm going to turn it over to Junia now, who will discuss the healthy lifestyle resources that we have available at Kaiser. Dr. Nguyen, that was a lot of really rich and valuable information, some of which you probably heard about before, some of which might be new. Go ahead and write in the chat, folks, one thing that really stood out to you, one takeaway from all the enriching information Dr. Nguyen shared. What was one thing that stood out to you? Yeah, thank you, Matthew. One thing that stood out to you, one thing you're taking away, the fermented foods. Yes, Bonnie, the gut health, the hungry brain, different reasons for eating too much. Don't skip your meals. Rainbow colors in your food, protein intake, slow burner. I'm not alone. Yes, Matthew. Emotional hunger, Chloe says. Yes, good, everybody. Good takeaways. So I have a pop quiz. True or false? I have a feeling this group's going to get the right answer, but true or false? The only measure of success to your weight loss, the only measure of your success to weight loss is when you step on the scale and the number changes. True or false? The only measure of your success to your weight loss is when you step on that scale and the number changes. I see a lot of falses coming through. Why is that? What are some other measures of success that tells us, hey, we're going in the right direction? What are some other measures of success? How do you know? Yeah, Ashley, how do you feel? You feel good. You have more energy. Your blood pressure is better. You feel stronger. You have muscles. Your clothes fit better. You have more energy. You're losing inches. Waist circumference is different. Muscle mass is different. Lots of really good benefits that the scale doesn't really capture. And yet, a lot of us, we bottleneck ourselves. It's just a number that matters. And yet, look at this list that y'all are coming up with. Exactly. So let's take a look at this slide. You start to enjoy new habits. You don't want to go back to the old ways of being. You have a reduced health risks. You have more energy to live life. You have increased mobility and ranges of motion, less pain. You feel good on multiple levels, physically, emotionally, socially. I mean, we're all adults. I can say this. I've had patients tell me they are having great sex. It's better in the bedroom. They're having better sleep. I've had people come up and tell me their hair is healthier. And I was like, I don't know what that's about, but awesome. And they're like, maybe because of all the water I'm drinking and nutrients I'm eating from the fruits and vegetable servings. So even the hair is getting healthier. This is what research tells us, tried and true. Lifestyle habits that actually work. beyond just the numbers on the scale, but overall in your weight loss journey success, being mindful of calories. We don't just eat calories, we drink them too. Calories is just a unit of energy measure. It's not evil. It's not little critters that crawl into your room to sew your clothes on tighter as you sleep. No. Calories, it's just energy for your body. Why do you eat and drink calories? Because you need energy to live. The thing is, a lot of us, if the car's tank can only hold 30 gallons and you're pouring 60 gallons every day, what happens to the extra gas? Well, in terms of calories, we store it as extra food. It doesn't leak. Sleeping well is important. If you join our 6-week online healthy weight series, free for Kaiser members, by the way, outside public has to pay. And we'll talk about how to sign up for that class. We talk about sleep research in class 6, how it impacts weight loss and weight gain and hormonal health. Tracking is really important. What do we mean by tracking? Outside, out of mind, right? What's the human tendency? What are we really good at doing as human beings? We're really good at overestimating the amount of calories we burn. Heck yeah, I burned 4,000 calories. I mean, I better burn for, I was in the gym for like 2 hours. And we're really good at underestimating the amount of calories we intake. I ate probably like 200 calories. I'm gonna take a few bites. If you're playing this overestimating and underestimating over time when you can't zip up your pants or you slip on the skin, you're like, that doesn't make sense. It's because we haven't been tracking. So tracking and logging keeps us accountable. Managing your stress is really important. Being physically active. Oh, another pop quiz. Let's see if you've been listening to your Kaiser doctors or nurses or PTs. Who knows? What is the weekly recommended amount of exercise minutes for overall health? For overall health, how many minutes of exercise do you exercise in a week for overall health? What's the recommendation in a week? I end up going in the right direction. So Selena's warmer, April's got it. Okay, so 150 minutes in a week. So that means all the people saying 30, you're correct, 5 days a week. 30 minutes, 5 days a week. So it's Monday through Friday, 30 minutes. That's 150 minutes in 7 days in a week. For weight loss, though, does anybody know? There's a different number for weight loss. You got to double it, 300 minutes with more frequency throughout your day. Okay, so maybe it's a mental reframe. I remember the first time the doctor, I also went through my weight loss journey. I went to the doctor, they're like, you need to at least get 150 minutes in a week. I was like, Doc, I do not have that kind of time. And then I realized it might be a mental reframe that I need. So see if this one helps you. Maybe you thought of this in this light before. I never thought of it in this light before until I did. It made a world of difference for me. So I was like, oh, Genie, 150 minutes, that's 30 minutes a day. That basically means for 23 and a half hours of your day, for 24 hours in a day, everyone has 24 hours, it's fair, yeah? For 23 and a half hours of Monday through Friday, Junior, you have full permission to couch potato, sit on that butt of yours, lie down. But just for 30 minutes of your 24-hour day, can we get up and move? For just 5 days a week. That's it. Just, you've been sitting down all day, get up and move 30 minutes. And you can break it up into 10-minute chunks. So 150 for raw health, 300 for weight loss. Strength training, they don't tell us about the minutes or frequency, but at least 2 or 3 times a week for strength. Being mindful of risky substance abuse, I'm going to invite you to massage this definition of substance, not just tobacco, vaping, smoking, drinking. By the way, to date, current research tells us there is no safe level of alcohol consumption that is safe for us. If you're not drinking alcohol, the recommendation is you don't need to start. Okay, if you're already drinking alcohol, we're not here to say no more alcohol ever. We're just saying be mindful about that. And to substance, also think about what else did you consume? Social media, right? So maybe be mindful of that substance abuse. Does anybody know the average American, how much screen time they use in a day, not work related? Does anybody know? The average amount of screen time for an American, not work related. Whoa, Misty, that's really good on your first try. 7.5 hours. We spend 7.5 hours locked onto some sort of screen, not work related. That's a full-time job right there, looking at a screen. What if we use that instead to prep healthy meals, drink water, and exercise? A world of difference. So like Dr. Nguyen said, choosing healthy foods, beverages, I love when she says, eating the colors of the rainbow. I had two patients tell me they went home for a week to just look at the colors on their plate. And they're like, holy guacamole, we are colorblind when it comes to food. It's only white, yellow, and maybe brown fried foods, right? Starchy foods. So maybe it's about adding some more color to your diet this week. I once went to a food as medicine conference and they said, how come if you bring your dog to the farmer's market or the produce section of your local grocery store, how come you know all the colors? How come you can see it? Because you're meant to. Because it's going to give you the vitamins, nutrients, and minerals your body needs. So, quick question. Even if you didn't study this, how do you know what's going to be high in vitamin C? Like what color would you see in the produce section or fruit section, veggie section? How do you know something's going to be high content in vitamin C? Yes, it's going to be citrusy colors, yellow, orange, reds, deep greens. You're meant to see the color because your body needs the nutrients. Good job, everybody. We're going to show you a quick 4-minute video called Lifestyle Medicine. When we're showing the video, let me go ahead and pull that up. I want you to think about two things. I want you to think about what is one pillar you're currently doing well in. What's one pillar you're currently doing well in? I'm going to put it in a chat for you to think about while I pull up the video. What's one pillar you want to do better in this week? Why am I asking one pillar you're doing well in first? Because behavior change science tells us, so the science behind behavior change tells us, there's one thing you really need to make habits stick, to even be motivated to make a change in your life. Does anybody know what that is? That one thing you need? You need self-esteem. You need esteem for self. Love that, Matthew. You need love that. You need to feel good about yourself, confident in order to even attempt to make a change. So let's give ourselves some confidence. Tell me one thing you're doing right. You can give a nod at that. And then tell me one thing you want to do better in this week. Okay, let's watch this video. Spend more time with love. And what if it were possible for everyone? Fortunately, this exists, but it's not a blockbuster drug. It's called lifestyle medicine. Many of our doctors are board certified by the American College of Lifestyle Medicine or knowledgeable about how lifestyle medicine can improve your health. Years of scientific research have shown us that a healthy lifestyle, your daily habits, is just as important as other medical care in promoting health and preventing disease. Lifestyle medicine is built around 6 essential pillars. These are eating mostly whole plant-based foods, being active, sleeping well, managing stress, staying connected with others, and avoiding risky substances. In fact, if you practice these healthy behaviors consistently, it's possible to prevent or delay many chronic conditions like type 2 diabetes, obesity, high blood pressure, and even dementia. Studies show us just how interconnected and important these 6 pillars are, and that improving one favorably improves others. The reverse is true as well. For example, we know that one of the many benefits of eating a whole food plant-based diet is decreased inflammation in the body. Eating mostly plants can help you lose weight, reducing the load on your joints. This means you might have less pain and swelling, making it easier to stay active. If you move more, you're more likely to sleep and feel better, and the positive effects continue. Why follow the 6 pillars recommended by lifestyle medicine? Here are some specific benefits. Eating mostly plant-based whole foods also increases good bacteria in the gut. This improves your overall health, aids digestion, and helps you feel fuller to support a healthy weight. Moving more every day keeps bones and muscles strong and helps with balance and flexibility. It can speed up your metabolism and burn calories. It can also boost mood and improve attention, learning, and memory. This helps us stay healthy and independent as we age. We all know how great it feels to get a good night's sleep. It gives you more energy and even improves your heart health. And people who get 7 to 8 hours sleep each night tend to live longer. Stress is an inevitable part of life, but too much of it can affect every organ in your body. Finding positive ways to manage stress, such as breathing deeply, listening to music, or taking a break from social media, helps us relax during tense times. We have resources to help you develop long-term coping strategies. Maintaining social connections, spending time with supportive family, friends, and others, even if your interactions are brief, is one of the most important predictors of human happiness and longevity. Avoiding tobacco and too much alcohol, or not drinking at all, is critical. These substances increase the risk of many illnesses, including cancer and premature death. Ready to make a lifestyle change? We know it can be difficult. No matter what your health goals are, we can help you take some positive first steps. We also have wellness resources you can take advantage of. You can talk to your doctor about what's right for you. Hey, let me see in the chat. What is one thing you're currently doing well in and one you want to focus on more this week? So I see we're good at eating veggies. We want to work on stress. We need to do sleep better. We're good at workout. We want to make better habits. We got to move more. I'm doing good on exercise. I got to work on the alcohol. Great job, everybody. Just pick one of these pillars and they will build upon each other the momentum. Start with one and just check in with yourself, 0 to 10. How ready am I to make changes to my diet, to get in more physical activity, to track, to get more sleep, to manage stress? Because I'm not ready at all. 10's I'm ready. What's going to help me feel more ready? Part of this equation is kind of checking in to see what works best for me. What am I most interested in trying first? And taking a look at past endeavors. This is what I like to say. Who's tried weight loss in some way before? You paid somebody, you paid a programmer, you tried it on your own. Majority of us have. I'm going to encourage you to take all of those past endeavors and I'm going to introduce one of my favorite words in the dictionary. Use it as data, D-A-T-A. You just collected some majorly valuable data on what works for you and what doesn't, what's sustainable and what isn't. So take all that past data and think, what's the best support I need to help me function best? What is my best learning styles where I learn best in a group or individually, online or in person or by phone? Well, guess what? We have all the resources to support all those learning styles. If you go to this QR code, you can sign up to a lot of mind body classes that we offer here at Kaiser, or go to the kpdoc.org/classes with classes for diabetes, healthy weight, lifestyle medicine, pregnancy, emotional well-being. Lots of really great classes in English, Spanish, and Cantonese to take online. Some of the classes we want to highlight is our Healthy Weight series. This is a 6-week online class, 2 hours each, free for Kaiser members like you. You get to be amongst like-minded community, people who also want to lose weight like you. And we'll go through topics like nutrition, activity, how to overcome sabotage, and goal setting based off of effective scientific tips. When just last week, my family and group, we actually did share exercises live together. We sat in the chair and we swayed. Okay, so really, really great class, 6 weeks here to support you. Maybe you're also interested in a healthier diet. So we have our whole food plant-based eating class. This is a one-time session, 2 hours online, free for members. This is now, to date, the #1 diet to help with disease prevention and disease reversal. It's not only going to prevent disease, it's going to reverse your diseases. So you're just like, they're trying to convert me to be vegans. That's not the goal here. It's just introducing the benefits of eating plant strong, plant forward. Maybe you want a coach to keep you accountable. Well, we have that as well. Wellness coaches, 6 free sessions, 20-minute phone calls for 6 months. You get another 6 free sessions reset for next 6 months. They'll work on healthy eating, quitting smoking, exercise, stress management, weight loss, sleeping better. About 8-9 years ago, regional headquarters was pushing us to promote the wellness coaches. They're like, we hired a bunch of people. They're sitting, these professionals by the phone. No one's calling them. And so I called them up and I said, fully transparent, I was like, I also work for Kaiser. I just want to know what y'all are about before I recommend you to my patients and classes. Within 2 of my 6 free sessions with my wellness coach, I was able to stop a habit that for whatever reason I couldn't stop on my own 2 years leading up to that call. I like, this is old. This is a hidden gem because our wellness coaches are trained in something called MI, motivational interviewing. So you haven't hit this resource yet. Really, Milk, it is free. Why not? If you like more self-guided options, we have fitness discounts we're going to put in the chat. One Pass Select is something that just started this year, where you pay a single fee and you get access to a multiple amount of gyms in your area. You can also download the Calm app and the Headspace app for My Wellness, Better Sleep for free as a Kaiser member. So we'll drop all of that in the chat. So whether you want to take a class with a group community field support, you want one-on-one coaching, or you want more solo options for self-care apps, we have all the resources to support you. You can also go to that website, apdoc.org/healthyweight, put it in the chat as well to access all of these options we're saying that you have access to. But wait, there's more. I'm going to pass the ball over to Dr. Nguyen to talk about even more in-depth resources if you'd like some more support within Kaiser. Thank you, Junia. All right. So as you can see from this slide, lifestyle modification is the foundation of any weight loss routine. The other things, the medical weight management, the obesity medication, the bariatric surgery, all of those are additional support. The most important thing is to lay down a strong foundation and maintain that throughout your weight loss journey. Without a strong lifestyle foundation, you won't be able to achieve the weight loss that you want, even with medication or surgery. I can tell you now, with my own experience, I've had to take a bunch of patients off of medications because they weren't losing on the weight. I've had patients on Ozempic for 6 months or 9 months, and they've only lost 30 pounds. Yeah, something's going on if you're not losing the weight or you're losing so little weight. So as you can see, lifestyle is the foundation of weight loss. In the next couple of slides, I'm going to discuss the medical weight management program and the weight loss surgery that we have available here at Kaiser. Next slide, please. So Transform is our medical weight management program. It's a fee-for-service program, which is spread over 18 months with weekly meal programs, online sessions, and regular monitoring by physicians and nurses to help you lose weight. Anyone can sign up. If you have neighbors, your family member who's not a member of Kaiser, they can sign up. You don't have to be a Kaiser member in order to sign up. And you can actually use your flex spending account to pay for the program fee, not the meal replacement, just the program fee. If this is something that you're interested in, we do have a free intro session that you can attend to see if it's right for you. I've had a number of patients, as well as my colleagues, physicians, who have done this program, and they've lost a lot of weight and they've been able to keep it off. It's actually a really good program. Next slide, please. And then there's weight loss surgery. And this is usually recommended for patients with a body mass index of 40 or greater, or body mass index of 35 with associated comorbid conditions such as diabetes or high blood pressure. So the surgery changes the anatomy of the stomach. It actually makes it smaller so that you eat less. Because the surgery makes the stomach smaller, your stomach is no longer able to absorb all the nutrients that it needs. So after surgery, you will be required to take vitamins and minerals daily, and you will be asked to get labs done on a yearly basis to check up on those vitamins and mineral levels. It's very important to know that the surgeon will require you to lose a certain amount of weight prior to surgery. Usually it's about 5% of your current body weight. And this is to make sure that you have a healthy lifestyle foundation in place for after surgery. And this also is meant to reduce the abdominal fat, which will improve the surgical outcome. So some important criteria for qualifying for this surgery. You have to be 18 years and older. Females cannot be pregnant. You cannot have any severe comorbid conditions. You cannot have any uncontrolled mental health issues, no substance abuse, and you have to be committed to a healthy lifestyle after surgery. So no matter which weight loss options you choose, whether it's medication, weight loss surgery, or just lifestyle modification, I want you to know that you have a supportive team here. You have your primary care physician, you have your health educators, your pharmacists, and you have me. A number of us are on the obesity team. We are happy to help you. Your primary care physician can always consult with us. This is the end of my portion of the talk. I want to thank you for being here, for taking this important step, and for prioritizing your health. And I hope that information has been helpful to your weight loss journey. Thank you. Thank you so much, Dr. Nguyen. Amazing, amazing. Thank you so much. We're going to pass the ball over now to Dr. Yu now. Let's going to talk about an overview of the different weight loss medications. I'm going to emphasize the word overview. There's going to be a lot of information about the different medications. Your job is not to memorize all of them. Your job is to fill out the self-questionnaire at the end of the presentation so that our pharmacy team will reach out to you one-on-one with your file to go over what's the best one for you. But this is kind of just a sprinkle of information so you can get an exposure to it. Okay. All right. I'm going to pass the ball over to Dr. Yu now. All right. Thank you for that. And yes, I'll emphasize what my colleague Julia had mentioned. This is just going to be an overview of the medication options that we have. If you're interested in these options and you're a candidate for enrollment, you will be going over them in more detail with your provider at that appointment time. So again, there will be no pop quiz at the end on these medications, just something to go over. So we start with this slide. I'm sure you all may have heard about the now very popular weight loss injectable medications that are out there. So I'm hopeful to shed more light on those as well as additional options, talk about possible pros, possible cons to each of them, and give you guys an overview of what's available here at the Weight Loss Medication Management Program. Next slide, please. Okay, so for example, this is just one thing to note out, not saying that it's very common, but rare but serious. Ozempic now includes an intestinal blockage warning. So this is just one example that we don't recommend starting or managing weight loss medications by yourself. I know there are a lot of resources out there, some online, some in person for weight loss medications. We just ask that you be cautious. And, this is just one example of a serious adverse event that could occur with a medication. Next slide, please. So unfortunately, weight loss medications aren't a miracle. It would be great if they were. Lifestyle changes are necessary for them to work. They won't necessarily work for everyone. There's no one size fits all. We may have to try one or two agents before we find the one that's the right fit for you if it's appropriate. The weight may come back after stopping the medication in the future. What we've noticed is in our patients who combine these weight loss medications with their healthy lifestyle changes, with that diet and exercise, those patients are able to keep more of the weight off more successfully when stopping the medications versus patients who are more so just relying on the medications themselves for weight loss. And again, all medications do come with some potential side effects, and some of the side effects can be challenging. So just something to keep in mind as we go forward. Next slide, please. Okay, so who would be a possible candidate for weight loss medication? So weight loss medications could be an option for patients who have already worked on those lifestyle changes for at least 3 months. So diet changes, exercise changes. Ideally, we would see a minimal weight loss, 1 to 2%, but not required. We just want to know that you're, making those changes and in a good place to start the medications. Patients who have a BMI of 30 or greater would be a good candidate, or if you have a BMI of 27 or greater with certain additional health conditions, for example, diabetes or sleep apnea, you could also be a good candidate for weight loss medication. We're looking for patients who are willing to commit to somewhat of a longer term use of the medication. Again, it's not a miracle. It won't be just a 1-month fix. It could require months of follow-up. We're looking for frequent monitoring with that follow-up in our program. We do ask that you get your blood pressure and weight checked every month so we can make sure that the medication is both working for your weight and staying safe with your blood pressure. And, we ask that you be flexible. Again, it's not a one size fits all. So we might have to change the weight loss medications throughout your enrollment in the program. Next slide, please. Then some exclusions to keep in mind: weight loss medications are not appropriate for people who are pregnant or breastfeeding, patients with an active eating disorder. If you've had weight loss surgery within the last year, or you're planning on having it in the upcoming year, or if you have a mental health condition that is currently unmanaged, those would be patients who might not be a great candidate for weight loss medication at this time. Next slide, please. So in terms of our goals when taking a weight loss medication, especially within this program, we're looking for around a 5% weight loss within 3 months for us to determine if the medication is starting to work. Now, the reason that we have it at that 3 month mark is because weight loss looks different for everyone and is on a different timeline. So we give, a couple of months for the medication to build up in your system for it to start to work. And then we use that percentage amount instead of just a certain pound amount, because everyone is starting at a very different, starting weight. So we don't want to keep you on a medication that's not working. I'm sure you don't want to be on a medication that's not working. So we want to, shoot for that 5% goal within 3 months. Not to say that you'll be kicked out of the program or stopped on the medication if you don't meet that, but that's just how we can determine if the medication is working effectively. We also see some improved blood pressures with weight loss, improved blood sugars, cholesterol improvement, any sort of joint pain improvement, sleep apnea improvement. Those could all be benefits of the weight loss medication. We want to keep you on a medication that is tolerable. If you're having side effects, that would mean that medication is probably not the best fit for you if they're not tolerable or going away. So that's something that we're looking for in terms of success. And we also want to make sure that you have those lifestyle changes and support in place, whether that's, the classes, the food and activity tracking, just to have something in place, if and when you do go off of those medications in the future. Next slide, please. So again, as I touched on earlier, we do require monthly in-person monitoring. The either Healthy Living Center or a Kaiser near you for that weight, blood pressure check, just to make sure that the medication is starting to work and that you're staying safe. We'll be checking in over the phone for appointments, making sure that you're tolerating the medication, talking about side effects, and answering any questions that you have. So we'll be meeting monthly while you're in the program. We'll work with your primary care provider to optimize the medication within the first couple of months. So the first couple of appointments will be more so discussing the medication, determining which one you could be the best candidate for, starting that medication, checking in, seeing if the side effects that you're experiencing, if any, are tolerable. If so, then we'll continue and monitor the weight. If you're not tolerating the medication while you're having some of those side effects, then at that point, we'll go ahead and switch the medication. And then once you're stable on the medication, ultimately, you'll check back in with your primary care provider to talk about future weight loss management on the medication. Okay, next slide, please. Okay, so now I'll talk about the specific medications. First, I'll go over the overview. So looking at this slide, you'll see that the first line medications are going to be our oral agents. And then the second line medications that we have are going to be our injectable options. I'm sure you might have a couple of questions about that. So I'll touch on why that is the case for the weight loss medication management program. So one of the first and foremost reasons is that these oral medications that are currently available for weight loss have been on the market longer than these injectable medications for weight loss. And because of that, we know their longer term safety data. There's more data out there than compared to their newer injection counterparts. Kaiser did a study that showed very similar, if not equal, levels of effectiveness comparing the orals and the injectables. So if they're both working about the same, then we want to keep you, if we're able to, on a medication that has been studied for longer. Again, the side effects are more well known, shorter term, especially longer term. So that's just, a couple of the reasons why within this program we do start on those oral medications. If you're not a candidate for oral medications for whatever reason, or those medications aren't tolerated or effective, then at that point we can discuss the injectable medications. Again, those are going to be newer with less longer term safety information. There is good evidence for effectiveness as well. And then the side effects, again, could be severe, and especially those longer term ones where those studies are still ongoing. Next slide, please. There is one over-the-counter agent approved by the FDA for weight loss. It's called Orlistat. It can work by blocking fat absorption from your food, and it can result in some pretty loose and oily stools or bowel movements. So if you're interested in that, that's something that you'd be able to pick up over the counter, no prescription required. But then we'll go forward and talk about the prescription medications. Next slide, please. Okay, so these are some medications that can be used for the hungry brain. So if you're having any cravings, any food noise, these medications might be particularly helpful. So I'll jump down to number 2, that phentermine medication can help curb appetite. You may develop a tolerance in the future to it. It might cause higher blood pressure, anxiety, insomnia. It acts as almost a stimulant. We can use it by itself or with that first medication called topiramate, which can help with carbohydrate or soda cravings, nighttime eating or food cravings. With this one, you might experience some numbness, cognitive slowing, emotional ups and downs, and it might lead to kidney stones if you've had them in the past. I'll go down to number 3, the combination bupropion and naltrexone is also helpful for that hungry brain. So those food cravings or food noise, also particularly helpful with alcohol cravings or intake. The side effects for this combination might include some dizziness, nausea, fatigue, headaches, or feelings of anxiety as well. And then that last option on the bottom of the slide here, metformin. This medication can help curb your appetite. It would lower your blood sugar, but not too much to the point where we would be concerned about low blood sugar. So it is still a safe medication. And it might help with any sort of insulin resistance that you may be experiencing, especially if you have prediabetes or diabetes. Side effects for this medication would be mostly stomach related. So diarrhea, possible nausea, or vomiting. It also, if you have a vitamin B12 deficiency, might not be the best choice at this time. Okay, next slide, please. Okay, again, we have gone over the medications already that are on this slide, but I just want to show that these medications can be doing double, if not triple duty. So in addition to the hungry brain, they might be beneficial for the emotional brain. So if you're more emotionally driven, you're experiencing, binge eating, low motivation, emotional eating, and these agents, the topiramate for binge eating or the bupropion naltrexone for the mild depression, emotional eating might be, good fits for you in the future, depending on the appointment that you have. Next slide, please. Okay, and then again, you've seen these medications before. These are going to be particularly beneficial for the slow burner. So these medications can help boost your metabolism. And we have that phentermine that we can use with or without the topiramate. It's a stimulant. It can increase some of the chemicals in your body to help you burn more calories. It also helps slow down some of the food emptying and increase the amount of energy that you're spending. And then that metformin at the bottom might help boost your metabolism by lowering insulin resistance. So again, all medications that we've seen before from the previous slides, but some of them are doing double, if not triple duty. Okay, next slide, please. Okay, and moving on. So again, we'll start with the oral medications if we're able to, and then for whatever reason, if we're moving on, then we'll go on to the injectable medications. So they work by regulating the increased GLP, which is a hormone that helps regulate the blood sugar levels and appetite. It can slow down the food in your stomach, leaving you fuller for longer. It's effective for the hungry brain and emotional brain. The side effects of these medications can be nausea, vomiting, constipation, abdominal pain, possible diarrhea. Some patients also experience some headaches or fatigue. For this class of medications, the injections, we would require, closer monitoring. Again, emphasizing on what I had mentioned before, there is limited long-term safety data out there. There, are drug shortages just depending on the brand that you are prescribed, either Ozempic or Wegovy for that semaglutide or Victoza for the liraglutide. Additionally, one thing to keep in mind for this medication class, for the injectables in general, is insurance coverage. So even if your provider determines that you could be a candidate for an injectable medication, it may not be covered. I'm going to include now the phone number for member services. They'll have more information on whether you specifically could be covered for an injectable in the future. Additionally, they can also let you know if you would be covered for oral agents as well. Okay, so that number is in the chat. There are some changes to insurance coming starting in January, but hopefully they would be able to let you know if that coverage were to change in the new year. So again, this is just a higher level overview of the medications that we have, both the orals and then also the injectables as well. Thank you so much, Dr. Yunel. So folks, before we finish tonight and open up for Q&A, I'm going to go ahead and put the QR code for the survey right now. This is the self-questionnaire that you need to fill out in order to be registered and logged into our system for our pharmacy team to reach out to you individually within the next 2 to 4 weeks. So we're going to put the link also in the chat for you to fill out, but do finish this before you log off tonight, or else you will not get pinged into our system. So fill that out either with your phone, take out your camera function and scan this QR code, or click on the link we're going to put in the chat to access the class self-questionnaire. So you fill that out. What I'm going to do right now is I'm going to open up the floor for any questions, whether in the chat or through your raised hand for microphone. So you can either raise your hand or write your question. So the first question I see in the chat is, how do we know our BMI? Dr. Glenn, Dr. Yunel? You can actually determine your BMI in the office. So your body mass index is a combination of your height and weight. We determine that based on your height and weight. And, BMI is just, it's not very accurate, right? Because you can have a bodybuilder come in and they can have 5% body fat and they will have a high BMI because of all the muscle weight. So we always take BMI with, a grain of salt. If Dr. Nguyen, thank you for the question. And folks, for those who are going to ask questions through the raised hand, this is my invitation. There's like 50, 60 other strangers on this call. You might not want to personally broadcast your personal situation. You might want to hold on to a personal question until our pharmacy team reaches out to you by phone. They'll have your file ready and they can answer any personal questions you have. But if you have any questions about the presentation, this would be a good time to ask. So any other questions? And if you have no questions and you're done with the self-questionnaire, you can log off and then wait for our pharmacy team to reach out to you. But we'll give just folks another good 5 minutes for any questions through raised hand or through the chats. Thank you. Thank you for joining us. So Leilani, I see raised hand. Did you have a question? Let me go ahead and allow you to unmute your microphone. Leilani, I saw your raised hand. Did you have a question? I answered my own question. There we go. Perfect. Love when that happens. Thank you. Any other questions? We see questions in the chat. Once you've submitted your self-questionnaire, you are linked into the system. You can log off. Thank you so much for joining us. Let me scroll up just to see if there's any questions. I hear a lot about intermittent fasting with medication. Any take on that, Dr. Nguyen? Yeah, if you're able to do intermittent fasting, studies have shown that intermittent fasting is actually a good thing to do. It helps with blood sugar. It helps with the weight loss. But you have to be careful, because if you're not used to intermittent fasting, after you get out of the fasting phase, you can be extremely hungry. I know, it's kind of difficult. Here I am saying don't skip meals, and then you have intermittent fasting. And so when you look at it, the two contradict each other. But if you're able to do it, normally with intermittent fasting, they recommend fasting from about 7 o'clock, 7 p.m. So that should be your last meal at 7 p.m. And then you fast until 11 a.m. or 12 noon. And then you would have your meals between 12 noon or 11 a.m. to 7 p.m. So get your calories in at that time. But the reason for intermittent fasting is, we tend to be less active at nighttime, right? And so a lot of people tend to eat later in the day or at night, and they have snacks and whatever. Let's go out. Hey, let's grab a drink. And then that's how you pack on the calories. But studies have shown that intermittent fasting is actually beneficial. Dr. Nguyen, thank you for the question, Robert. Lima says, I also have questions about patients with severe apnea using Zepbound as an option. Dr. Nguyen? Zepbound has been approved for sleep apnea, but it still has not been approved within Kaiser. We're still working on that. And with insurance coverage, that is still up in the air whether insurance coverage will cover Zepbound for sleep apnea. So that's something that we're still working on. And so, so I just want to clarify, just because you have sleep apnea, does it mean that you automatically qualify for Zepbound? So don't call your doctor and say, hey, I was diagnosed with sleep apnea, I'm on the CPAP machine, you have to give me Zepbound, because it has been approved. That's not the case. Okay, so it has been approved, but that doesn't mean that everyone who has sleep apnea can get Zepbound. Thank you, Dr. Nguyen. Thank you, Rima, for the question. I see Dr. Yunel's working really hard answering the questions in the chat. Let me see. What is that? Misty is asking, what is Zepbound, Dr. Nguyen? Or Dr. Yunel, I saw you unmute your mic. Did you mind? Sure. So it's another injectable medication. Sorry, I'm trying to answer everyone's questions in the chat about Zepbound, but it might be easier if I just speak about it on here. So Zepbound, the brand name, is for tirzepatide, the generic name. So it includes part of Ozempic or Wegovy, so that's semaglutide, plus another component. It's a more restrictive medication here at Kaiser. So it's another injectable medication. We've been getting a couple of messages asking about it from the weight loss medication management program. Because it is a more restrictive medication, typically other medications are required first if you are a candidate for it, going through that stepwise that we had talked about. So first you would discuss the oral medications, then the other injectable medications, including Wegovy or Ozempic, depending on which would be covered by your insurance, if any. And then going from there, we could potentially discuss Zepbound if and when, after trialing those medications, if using for weight loss. And again, it's not something that can be managed within our specific clinic. We would have to pass it off to our physician leads because it is a more restrictive medication. So I just want to give everyone a preview of steps to come if you do make that request. That is something that you might expect, just having to discuss with your team and then going through the other medications that you could be a candidate for before being evaluated for that Zepbound or tirzepatide. So I hope that helps clear up some of the conversation. And this is with or without sleep apnea. After an email, thank you, Misty, for the question. I see in the chat we have maybe time for one more question. Doretta says, when you say activity, my job has me on my feet. Wouldn't that be part of my daily activity? Dr. Nguyen? I'm sorry, can you repeat that? I was busy looking at the chat to see if I can answer some questions. Yes, there's a question. When you say more physical activity, my job has me on my feet already. Wouldn't that be part of my daily activity? Yes, it would be part of your daily activities. So if you have a little tracker or a little counter that counts your steps, it will count your steps and it will be part of your steps.